Are you ejaculating before you or your partner wants to? I'm Dr. Rena Malik, urologist and pelvic surgeon, and today we're going to talk about premature ejaculation and how exercising might be able to help you improve your time to ejaculation. So what is premature ejaculation? Premature ejaculation is very common. In fact, up to 30% of men experience premature ejaculation, which is essentially where a man ejaculates sooner than he or his partner would like during sexual activity. The International Society of Sexual Medicine has created a scientific definition of premature ejaculation. And what it is ejaculation that always or nearly always occurs prior to or within about 1 minute of vaginal penetration. That's usually lifelong, meaning from the first sexual experience, or it can be a clinically significant, meaning it's bothersome, reduction in latency time, which is the time to ejaculation, usually within 3 minutes of vaginal penetration or less, which is acquired premature ejaculation. Now, as I mentioned, this is extremely common, and it can be obviously a real source of frustration and distress for a lot of men. The good news is there are effective ways to manage it without even needing medication. So over the past few years, researchers have been trying to look at non-pharmacological approaches to treating premature ejaculation. And while these are initial results, I wanted to share them with you because I found them really interesting. So one of the most interesting areas being looked at right now is using physical exercise. So you might be wondering, why would exercise help premature ejaculation? They don't even seem to be linked. Well, it turns out that certain types of exercise, like high-intensity interval training and pelvic floor muscle training, can actually improve ejaculatory control. And we'll get into exactly why. So let's start with HIIT. When you're doing HIIT, you're not only pushing your body to its limits, you're also paying close attention to your breathing and how your muscles feel. And with time and practice, this intense focus helps you get better at what we call interoception, meaning noticing and controlling these internal sensations. And there's also a thought that it might be helping balance your sympathetic and parasympathetic nervous system. This is the two systems that help essentially either activate you, make you ready to go, or allow you to rest. And this balance is really important for helping control ejaculation, or premature ejaculation in this case. And so, as I mentioned before, as you get better at thinking and your brain and body get better at communicating during high intensity interval training, you start noticing more things in your body. You might become more aware of your signals like hunger, stress, or fatigue, and how to manage those. And this again is called interoceptive awareness. And you can also use this interoceptive awareness to regulate your attention during arousal more effectively to allow yourself to sort of maintain that ejaculatory control. So let me share some of the data. There's a randomized controlled trial that recruits 76 Chinese men between the ages of 18 and 34 years of age. And they wanted to look at how does HIIT affect PE symptoms. And they used a specialized symptom score, and they placed these men into one of three groups. The one group was doing HIIT for 7 minutes a day. The other group was doing slow breathing exercises for 7 minutes a day. And lastly, there was a control group who just did natural breathing exercises. And what they found was that 2 weeks of daily 7-minute HIIT exercises led to significant reductions in premature ejaculation symptoms compared to the control group. And in fact, men also showed a higher heart rate increase during HIIT. Those men had fewer premature ejaculation symptoms. And this suggests that there may be a link between cardiovascular fitness and ejaculatory control. So next up is yoga. So yoga is another exercise that might help. And the reason it might help is for a variety of reasons. One is it improves physical and mental health. It enhances blood flow to the pelvis and strengthens the pelvic floor muscles, which are important for ejaculation and orgasm. It enhances mindfulness and reduces anxiety and stress, which all may contribute to at least acquired premature ejaculation. So the best data we have is a systematic review of 6 studies that had 433 men in them. And they looked at the impact of a few different types of exercise exercise. This included yoga, moderate intensity running, and HIIT. And so yoga was looked at in 4 different studies. And in these yoga studies, they saw an increase in the intra-ejaculatory latency time. In one study, it went from 33 seconds to 112 seconds, which is a little less than 2 minutes. And it went from 25 seconds to 88 seconds, a little bit over 1 minute. But in some of these studies, they compared them to medication. Now, one study found that yoga was more effective than fluoxetine. Now, fluoxetine is a SSRI, or a selective serotonin reuptake inhibitor, that's used to treat premature ejaculation, because one of the side effects of these medications is delayed ejaculation. And so that's pretty exciting that while these are not like groundbreaking, you're not going from 30 seconds to 10 minutes, so you're seeing results that are almost as good as taking a medication. So while that one study found yoga was more effective than fluoxetine, another study found that it was as effective as paroxetine, which happens to be one of the SSRIs that tends to have really good results. Now, one study looked at moderate intensity running, as I mentioned. Now, why running? Well, running is sort of similar to HIIT. It does improve cardiovascular health. It does improve blood flow throughout the body, as well as in the pelvic region, and it helps reduce stress and anxiety, and it may again improve this balance between both the sympathetic and parasympathetic nervous systems, which is important for premature ejaculation. And of course, regular running can increase stamina, endurance, and body awareness, which may ultimately translate to better sexual performance for a variety of reasons. So running in this one study increased the intra-ejaculatory latency time from 39 seconds to 188 seconds after about 20 days. And the last study was that same study on high-intensity interval training. And ultimately, what they concluded was that physical exercise interventions may need more time to significantly alleviate PE symptoms compared to drug treatments, but they may be as effective. They found that the HIIT study, or the HIIT intervention, appeared to be the most time effective, meaning at more quickly seeing results, followed by moderate intensity running, while yoga required the longest duration of time before they saw benefit. And lastly, they found that higher intensity physical exercise ultimately had better improvements in ejaculatory control and time to ejaculation. Now, it's important to realize that most of these studies are really small. They do have limitations in terms of they didn't report everything completely, and the methodology was not perfect. So these are not groundbreaking, randomized controlled, really well done studies, but they are very interesting. And these are things you can easily do at home without having to get anyone else involved, without having to go see your doctor, see a physical therapist. And so these are things essentially anyone can utilize. If you're watching this on YouTube, you can turn this off and next go watch a yoga video or a HIIT video and do that for 7 minutes, literally 7 minutes, and at 2 weeks you may see a benefit. And so I think that's really exciting, and I encourage anyone who's struggling to incorporate some HIIT or some running or even some yoga into your exercise routine and see if it makes a difference. So there are a whole host of other premature ejaculation treatment options, some of which I've covered in prior videos, but ultimately I wanted to focus this on things that you could do easily at home. So bottom line, if you're struggling with premature ejaculation, try these free things at home, and if you're still struggling, make an appointment with your urologist and talk to them, and there are a whole host of things we can do to try and help you so you don't have to suffer in silence. And as always, remember to take care of yourself because you are worth it.